And
you'll just, okay, that'll work. Because it's weird. So,
yeah, it's just picking up right here.
Okay.
Ready to go? All right. I am Amy Greenhall with Brigham City Community Hospital, and I just want to take a minute or two and tell you a couple things going on at the hospital. We have been ranked from Truven Health Analytics, one of the top 100 hospitals in the nation. And what that means is we are among the 20 best small hospitals in the entire country. So that's a pretty big deal. We're pretty proud of that. We also earned an A in the Hospital Safety Grades Awards. That's the second time in a row we have earned that. And that means that when you come in to have a procedure or you've had surgery or something, you are not going to get an infection at our hospital. We are very safe. We're a safe hospital. You're going to go home and hopefully feeling better from how you were, and you're not going to get sicker while you're at our hospital. We also, the Joint Commission came, and that's a really big deal to hospitals, and they came and inspected us. And we were named as a top performer in key quality measures, which is also a very big deal. That was also for 2014 and 2015. 2016 has not happened yet. The Patient Safety Excellence Award we also received from Health Grades, and that is also a safety issue, so you're not going to get an infection in our hospital. We're a very clean hospital. We are also chest pain accredited. We are a level 4 trauma center, and we are a stroke receiving facility. So we can handle any trauma that comes in. We can handle your heart attacks, your chest pains, immediately get medicine to your heart to help you recover. With heart attacks, time is muscle, and so you want to get to a hospital as soon as possible. You don't want to damage your heart muscle any more than absolutely at all possible. Stroke receiving facility is the same thing as well. Get the stroke stopped, get medicine in there to save your brain. And then one really exciting thing we've got happening this summer with our moving to our MOB being finished, we are going to have what's called an acceleration program in our physical therapy and our cardiac rehab program. And that is for all the coaches, all the athletes, all parents that are going to have kids coming up in the program. This acceleration program will help with almost any sport. We've got a high-speed treadmill on order. It will be coming soon to help with anything that needs speed. If you've got soccer, I even think it would help with swimming because you've got lung capacity with that. But a really good sports athletic training program and an acceleration program coming this summer. So we're excited for that. And I will now turn the time over to Alyssa Huff to talk to you about exercise.
Perfect. Thanks. So, like she said, my name is Alyssa Huff. I'm an exercise specialist for the cardiac rehab department at the Brigham Hospital, and I absolutely love my job. A little bit about my job is that I get to exercise with patients who have had heart attacks or heart-related, incidents in their life, even if it's chronic heart failure. We get to exercise with them, and I get to meet some really awesome people. So I wanted to start just by kind of going over that and introducing. We're going to be talking about exercise. Just follow that. Okay, perfect. So what is exercise? This is just my definition of exercise, but if you guys wanted to tell me maybe what you thought exercise was, that would be awesome. Anybody? Exercise. What comes to mind when you think of exercise? Some people are like, oh, but really, it's anything. What was that?
I even count stretching.
Yes, stretching.
Walking from the end of the parking lot, stretching.
Perfect. So like I put up here, exercise is any physical activity that gets us moving. So you don't have to spend hours in the gym. You don't have to pay some of, those expensive fees that you see at the gym, but it's just doing something that you enjoy. It doesn't have to be painful for your body. And one person's exercise may not be another person's exercise, and that's just fine. My next slide, is going to go over some of the benefits of exercise. And a lot of these we do see with even our patients. The second one is, of course, reducing the risk of heart attacks. But if we had, maybe taught our patients that before they had their heart attack, prevention is key. So we want to make sure that we're helping them and helping our own bodies reduce those risks of heart attack. Like the first one is decrease weight, and that's what a lot of people are trying to do. Or they think, oh, I'm going to exercise just so that I lose weight. Well, that doesn't, cover all of these other things that you're getting through exercise. you're, decreasing your blood pressure. We have a lot of people who come in and they're like, my blood pressure is so high. Well, are you exercising regularly? Are you eating a good diet? Well, no. Well, what are you going to do about it, So, another thing I think we may see, especially in any of the ages, but a lot of our younger kids, they're having anxiety and depression, but they're not getting out and they're not doing anything. They're sitting behind the TV, they're watching, they're playing video games, they're not going outside. I remember growing up, my mom just always was like, just go out and do something outside. So hopefully we can help, everybody kind of just enjoy doing something to get us a little bit moving. It also increases our confidence and self-esteem. We all want that confidence boost. Well, exercise is a great way to do that. I know that when I exercise, I feel maybe a little bit better about myself. I feel like, I kind of have this glow about myself when I exercise. Hopefully, we can improve our sleep, our circulation, our memory, strength, and endurance. All of those things come with good exercise and a good routine for exercise. So the next one is, who needs exercise? Everyone. It doesn't matter how tall you are, short you are, or how fast you are, or how strong you are. Everyone needs exercise. And I know that we have our patients that come in and they're like, I just had a heart attack. I can't do that yet. Well, yes, we can do something slowly. Over time we can increase to that 60 minutes that they would like us to exercise. So they would like us to exercise 30 to 60 minutes, 4 to 6 times a day. Well, some people that's just almost impossible. 4 to 6 times a week. Yeah, just 4 to 6. That's it. No, 4 to 6 times a week for 30 to 60 minutes each time. And later I was gonna, we'll talk about kind of how we can split those things up. But it doesn't matter. Whatever your circumstances are, exercise is good for you. So the next slide are, what are some of the things that we like to do for exercise? So each one of you give me one thing you like to do for exercise.
I like to bike.
Okay, perfect. Awesome. What about you?
I'm a walker.
A walker. Okay.
Wait.
Okay. Awesome.
Picking up smoothie.
Oh, good. Awesome. Bye.
Hiking.
Oh, hiking.
I'm also a walker.
You're a walker. Okay. So I just wrote down a few things that I like to do. I really, really like to water ski. So I'm excited to have my baby and be able to water ski. It will be the perfect time. So I'll be able to water ski. I'm not a runner. I don't like to run. I'm not good at it. It makes me just kind of angry, and so I feel like I probably shouldn't do that if it's not going to make me happy. So I try to do something else. I like to ski. I do like to do weights as well. That's one of mine that I feel like maybe I'm a little happier doing. So pick something that makes you happy. You don't have to do something that is uncomfortable for you or that is beneficial for someone else. Choose something that you like. So a few other things I want to mention while we're on that slide or before we go to this next one. Even though we may like to do something, we got to make sure that we're getting our heart rate up so that it is giving our body those benefits. Just, walking from this side of the room to that side of the room is great physical activity, but it's not getting our heart rate up. So if you would like to find out your target heart rate, it's 220 minus your age, so how old you are, and then take 65 to 85% of that number, and that's a good range for your heart to be in when you're kind of at the optimal target heart rate. So 220 minus your age, and then take about 65 to 85% of that. And then sometimes we do have patients, or if you know that when you've gone to the doctor or something, they told you not to get your heart rate over, a certain number, make sure that you're following that. We don't want any of you to overdo it if you're not supposed to. So some of the excuses are time. Time's a huge one. Some people just do not think they have time to exercise. And I know our lives are super busy, and we have kids' activities, and we have work, and we have to go home and cook dinner, and then we're tired. Well, it doesn't have to be all at once. So those 30 to 60 minutes do not have to be in chunks. We can do 10 minutes in the morning and 10 minutes in the afternoon and 10 minutes in the evening. We can all figure out 10 minutes to do something. And we just, again, want to go and do something active. Go and do something that will, get your body going. The next one is boring. So a lot of people claim that exercise is boring, and that's probably because they're not doing something they enjoy. You're probably stuck, running. So for me, I have to choose something that I enjoy doing and try to do it for 30 to 60 minutes. If you have to start slow, we have, I refer back to our patients because that's what's on my mind, but start slow, do 15 minutes, then do 20, then do 25. Work your way up to that half hour, and then once you're at that half hour, continue to work your way up so that we can get that 60 minutes in each day that they ask us to do. And I want you to think, I'm going to think on Dan for just a second. If you called into the school district and was like, I just don't have time to come into work today, what would they do? What would they say?
Well, I kind of have a job right
Yeah. So I think if we called into our jobs and, I called the hospital and was just like, it was just boring yesterday. I don't want to come in today. Or I just don't have time. Like, why are we making those excuses for exercise that is so good for our bodies, but we wouldn't dare make those excuses for any of the other activities in our lives? I don't even know if some of these excuses would be good enough for anything, really. So hopefully we can get past those excuses. I know I have a couple other on the next slide. Thank you very much. Lack of energy. People are too tired to exercise. Well, if you exercise, you might have a little more energy than you do before you exercise. A lack of resources or inconvenience. I'm going to put in a little stab for the hospital. But you can come and exercise at the hospital. We're going to have an awesome facility. It's going to be so awesome and big and nice equipment, so you can come in and exercise. And it's only $15 a month, which is really awesome. But a lot of people, lack of resources or inconvenience, it's too much to get a gym membership. They feel like that's the only place they can go and exercise. Whether fear of injury or sore muscles or the lack of support and companionship, people don't want to exercise alone. Hopefully, if you join, a gym, then you can find a friend, or maybe ask someone in your neighborhood to go on a walk with you. We can always find someone that would maybe benefit as well from exercise with us. The next slide is, I think, a little bit of a funny one. So exercise is like brushing your teeth. Besides working in the hospital, I actually work for an endodontist, and we do root canals all day. And if my patients came in and didn't brush their teeth as often as we don't exercise, it would be really hard for me to want to continue to work on them, So exercise is like brushing your teeth. You don't have to do it, but please do it for the benefit of you and the benefit of everyone around you. So, exercise is good for you, and it's good for other people. It makes you happy. It makes you a good person to be around. So hopefully we can remember exercise is like brushing your teeth.
We have a question in our
Oh, perfect.
They want to know if there's a cost.
A cost for probably the hospital. It's $15 a month per person.
Yeah,
So we just have you fill out a paper, you pay the hospital, and that's about it. So it's really, really easy and not. Yeah, monthly. The cost is monthly. We're open Monday through Friday, 6:30 to 6:30. Yep. Yeah. So you can come in now. A lot of people don't know about it, but yes, you can. And when our building's done,
Where's it at?
it's in the physical therapy room. So right off the professional building right now. Cardiac rehab's in there as well. We do have patients, obviously, that exercise with you, but we always try to be, we always share the room small maybe right now, but it's going to be so nice when we have our building to get patients in there. And also we call them wellness participants that come into the gym. But there's treadmills, there's bikes, there's free weights, there's a lot of things that you could be doing to get that exercise in. And we're open, Monday through Friday, which is hopefully you can find time in that time
Are they gonna have water therapy?
Yep. Oh, we don't have,
No,
no, we
we're
won't
gonna
have.
be on the third
Yeah.
floor, and so they don't wanna
They,
pull on
yeah, so they won't have, they won't have pool. But I think probably other places in the community, they do that, but at the hospital, we just have the gym. At the natatorium, they do water activities.
It just feels like their water is freezing.
Oh.
Do they
Um,
keep it
Does
cool?
the do any water aerobics?
They may do in the summer.
Right, so it might
be in
the summer.
Huh.
We do a lot of lessons. I just know over at Logan at their exercise academy, sports academy,
Mhm.
they have heated pools or at least a warmer temperature for older people.
Yeah, they keep the pool cool in that because of the swim team. Because when you're actually exercising hard in the pool, it needs to be cooler. You get
I know we've had a cardiac rehab patient who, she did water aerobics and she absolutely loved it. That was her very favorite form of exercise. She did, yeah, she did do water aerobics. And so that's an option as well, especially during the winter months. If you like to swim, there's obviously the swimming pool and that is good. So the next thing I wanted to talk about is goals. The next slide kind of goes over a few of them. Our goals need to be realistic. It's not that I want to lose 10 pounds by tomorrow. It's usually not realistic for most people. Attainable and meaningful to you. So you want to be something that's meaningful to you or you're not going to do it. So if it doesn't mean anything to you, it probably shouldn't be one of your goals. You should find something that means something to you. And then the next one is, don't be discouraged if you miss a day. It's okay. You have life. We all have life. And sometimes that happens and we have to just pick up the next day and continue on. It's not going to be a big disaster if you miss a couple for vacation or because you have a really, really busy day that day. Know that you're going to pick up the next day or as soon as you can and that it will all continue to be okay. Set short-term goals. Write your goals down, place them somewhere where you can see them. So if that's your bathroom mirror, great. If that's your fridge, great. If that's in your car, great. Set them somewhere on a sticky so that you can see them, or share your progress or goals with family and friends so that they can kind of remind you of those things that you're looking forward to and working towards. And then deadlines are important and rewards are good for people so that we can look forward to things. We want to make sure that our deadlines are, of course, short term, but we can also look to the long term as well. But if you're looking towards long term, set short term goals in between to make it to that long term date that you have set for yourself. The next one is, we share this a lot with our patients, is the FIT principle. You may have already heard about it, but it's for frequency. So we've already talked about 4 to 6 days a week, not just total. Thank you, Rachel, for helping me there. Intensity, we should feel like we're exercising. We should feel like our body's temperature is getting a little bit warmer, our heart rate's getting up, and that we feel like we're doing some exercise or physical activity. The talk and sing test is a little bit of a silly way to understand if you're working hard enough, but if you're too out of breath to carry on a conversation, you might want to slow down just a little bit. However, if you can sing a song, you're probably not working hard enough. So if you can carry on a song, step up your pace just a little bit. Time is 30 to 60 minutes. And type is choose something you like to do. Mix it up. You don't have to go running every day. Do running one day, weights another day. They say that, you get your aerobic and then you're also getting your strength training in if you do a little bit of a mix up on your exercise. And try to stretch every day. Try to do something that will maybe stretch those muscles. And then get your, so you don't get too sore or we prevent injury. The next slide is talking about safety. We want to make sure that our heart rate and our RPE, which is the perceived or rating of your perceived exertion. So if you feel like you're working really, really light, we call it a 6 to a 7. It's a scale from 6 to 20. And we want to somewhat be between right in the middle from 11 to a 15. So it's just basically how hard you feel like you're working, and everybody's different. I can have two patients on the same level on the bike, and one of them can tell me they're working at a 15, and one of them can tell me they're working at a 10. It's just your perceived exertion that you feel like your body's giving out. And then make sure that that's not going higher than maybe your doctor has told you. We want to make sure that we stay in that safe range for each of our bodies. Chest pain or pressure or pain in or radiating to the neck, jaw, shoulders, and arms, especially if you're having severe chest pain, you want to make sure that you're stopping and getting yourself help. Unusual shortness of breath, a little bit of out of breathness is not too dangerous. We want to make sure that you understand that if it's unusual or extreme, then maybe slow down a little bit can be good for you. And then dizziness or lightheadedness or nausea, make sure that, you may have to sit down for just a few minutes. Once you feel better, you can pick it up and go again. So, do we have any questions that I can answer for any of you?
When is the building open?
We're hoping June, May.
June,
May, June.
Let's say June.
Yeah.
Because things go slower than, yeah, exactly. Yes, so.
So it will be really nice. We'll have like 5 times the amount of room that we have right now, plus the equipment to come along with it. I know that Amber, my coordinator, has been ordering a few new things. So it will be really, really nice. A lot of our patients and our wellness participants that come in every morning faithfully at 6:30 to exercise, they're really ready for our new building. So it will be really nice.
It's gonna be on the 3rd floor facing west. The view is amazing.
Yeah.
So
3rd floor.
windows, just straight windows. You can watch storms roll in if it's winter. It'll be a really, really cool thing.
Yeah, it will be nice. So, and then of course we always are happy to take blood pressures if we need to. So our cardiac rehab team can always do that for you. So, do you have any other questions?
Current, hours again.
6:30 to 6:30 Monday through Friday. Yep. And I think that will continue as well. Once the building's done, it won't change.
Are there times during the day when
Later in the afternoon, they're probably less busy. Monday, Wednesday, Fridays, mornings, 6:30, are a ton of people want to get in there, but afternoons usually are a little bit slower, depending on patient flow, but that's a time. And 5:30, I sit there and I'm waiting for somebody to come in with me, so that's a time you can also come in. After work would be a good time. We have actually a few teachers that come in after school. So, anyways. All right.
Thank you.
Thank you.
girl or a boy?
Boy.